السلام عليكم. معكم دكتور بسام. نكمل اليوم المحاضرة الثالثة من الفصل الرابع بخصوص الهيموستاسيس والبليدنج تندنسي. نبدأ المحاضرة بسؤال: What do long flights, pregnancy and cancer have in common? Thrombosis. All of these are risk factor for thrombosis, long flight, pregnancy, and cancer. And this is what we will see in this lecture. Lecture objectives. At the end of this lecture, I should be able to define thrombosis, identify types of thrombi, explain Virchow's triad in the pathogenesis of thrombosis, recognize clinical consequences of thrombosis, define embolism, and identify the types of emboli. Thrombosis is a solid or semi-solid mass that occur within the vascular system. So, as you remember from the last session, we talk about hemostasis, and hemostasis function as to preserve the blood in the fluid state. In pathological condition, thrombosis will form as a solid mass without injury, without a clear cause for injury. So I will have a solid or semi-solid within the vascular system. The best or most famous explanation for thrombosis is based on Virchow's triad. Virchow's triad depends on three parameters: endothelial injury, abnormal blood flow, and hypercoagulability. As you remember from last sessions, we said when there is an endothelial injury, there will be exposure of subendothelial collagen, and this will adhere to activated platelet. So we need endothelial injury, subendothelial collagen, and activated platelet that will cause what is called primary hemostatic plaque. This fragile primary hemostatic plaque will be further reinforced by fibrin, so we need activation of the coagulation system. So in order to have a pathological thrombosis, we have abnormality either in the endothelial cells or in the blood flow, or we have a hypercoagulable state. Causes of endothelial injury are common and wide. Endothelial injury may be due to myocardial infarctions, may be ulceration of atheromatous plaque in cardiovascular system, patient when get old or hypertensive or diabetic, he or she will have atherosclerotic changes in the blood vessels. Atherosclerosis is a sort of thickening of the intima of the blood vessels. So this thickening, when become ulcerated, it will expose endothelial injury and will promote thrombosis. Bacterial endotoxin, especially in septicemia and severe infection, will cause extensive damage to the endothelial cells. Radiation, cigarette smoking, all these contribute to endothelial cell injury and promote sequence of events that end with thrombosis. The second factor of role in thrombosis is turbulence or stasis of blood flow. As you see in this figure, the normal condition, cellular element of the blood, RBC, platelet, and white BC have axial blood flow, which means they transported in the center of the blood vessels, while in the periphery of the blood vessel there is clear plasma. So there is, in normal condition, there is no adherence between cellular element and endothelial cells. In pathological conditions like heart failure, compression of blood vessels, there is slow blood flow. There is a sluggish blood flow. This leads to cellular element to get adherent to the endothelial cells, and this adherence may promote uh, thrombosis. Sometimes the patient has what is called atheroma. This is a part of atherosclerotic changes in the blood vessels, especially in elderly patients, diabetic, hypertensive patients, smokers. So atheroma, as you see, cause injury to the endothelial cells. In addition, they cause turbulence of blood flow. So blood cannot pass smoothly in this condition. As you see in this figure, another example of turbulence of blood flow. When there is aneurysm or dilatation of blood vessels, there will be turbulence of blood flow, and this turbulence will form what is called eddies. Eddies, spiral or circular fluid flow. So more cells will attach to the endothelial cells. Also, when there is a defective valve, especially in veins, there will be more spiral blood flow and eddies, and this will lead to turbulence of blood flow um, promoting thrombosis. When there is something compressing the blood vessels, this leads to turbulence and eddies formation, predisposing patient to have thrombosis. Another major cause of increased risk of thrombosis is hypercoagulability. As we mentioned earlier, coagulation factors have major role in thrombosis. So increase in function of coagulation factors or decrease in function of anticoagulant factors. As you may remember from last session, we have what is called procoagulant factors like thrombin, like prothrombin, fibrinogen, factor 8, factor 5. And we have anticoagulant factors like antithrombin, protein S, protein C. So when there is increase in the activity of procoagulant factors or decrease in activity of anticoagulant factor, this balance will be disturbed, uh, pushing the patient in the what is called thrombophilic conditions, hypercoagulable state. This hypercoagulability could be could be inherited as in mutations in factor 5, antithrombin 3 deficiency, protein C and protein S deficiency, or be due to acquired conditions like extensive tissue damage in surgery, in fracture and burns. This extensive tissue damage lead to liberation of a huge amount of tissue factors, which is initial markers to activate the coagulation system. Some cancers also increase the risk of thrombosis because they may secrete tissue factor like materials. Disseminated intravascular coagulation, we discussed this last week. Nephrotic syndrome and oral contraceptive pills both cause decrease in protein S, which is anticoagulant factors, and lead to higher incidence of thrombosis. This presentation, for further information about this presentation, I will upload for you a handout to review it. How we talk about the morphology of thrombi, how we classify thrombi. Either due to location, we have two major sites for the thrombi. Either they are venous thrombosis or arterial thrombosis. Venous thrombosis usually manifest as swelling, impairment of blood flow to the heart, while arterial thrombosis usually it is occlusive types and cause organ ischemia and infarctions. Microscopically, there is a difference between the two types. In venous thrombosis, mainly due to sluggish of blood flow, the congested RBC, so the thrombi called, it is a red thrombi. Red thrombi, because mainly it is composed of red blood cells. While in arterial thrombosis, thrombi microscopically characterized by what is called Zahn lines. Zine lines, these are zine lines. The zine lines are alternating white, red, white, red. There are layers of alternating white and red because the white band composed mainly of platelet and fibrin, while the red band composed mainly of RBC. These are pathognomonic for arterial thrombosis. So there is anatomical difference between arterial and venous thrombosis. There is different clinical presentation and sequelae between arterial and venous thrombosis. Uh, there is different mechanism uh, for cause arterial thrombosis mainly due to blood flow changes and atherosclerotic changes, while venous mainly due to slow blood flow or hypercoagulable states. Microscopically, also there is a difference in deep venous thrombosis or in venous thrombosis. There is what is called red thrombi, while in arterial thrombosis there is zine line we see in that thrombosis. Okay. So what about the fate? Patient already have thrombosis. So what about the fate? What will happen to him? Thrombus is already formed and obstructing part of the blood vessels. Either there will be resolution, which means there is dissolving of the thrombus by fibrinolytic system. Activation of the fibrinolytic system will dissolve this thrombus and blood flow will be restored completely. Or the thrombus may engulf more platelets and completely obstruct the blood vessels and may propagate to another blood vessels. This is called propagation of thrombus. That is to say, local extension of a thrombus to in the blood vessels. Another fate is what is called thromboembolism, when part of the thrombus, fragment of the thrombus is detached and travel within the vascular system and reach to distant organs. Example, thrombus in the deep veins of the calf, thrombi detached, and emboli will travel through the venous system to the right atrium, to the right ventricle, and to the pulmonary arteries, and causing occlusion of the pulmonary arteries, and pulmonary infarct will occur. The last phase will be organization, when this thrombus change into solid, thick, fibrous tissue, and later on there will be recanalization by endothelial cells and growth factor and forming small canals within the thrombi to restore blood flow. So these are the fate of a thrombus. For more details, it is given in the handout. So venous thrombosis, we have two types of thrombosis, as we said, venous thrombosis and arterial thrombosis. Venous thrombosis also have two types, either according to the anatomical site of the veins. Either we have superficial venous thrombosis. This is mainly occur in the saphenous vein, in the thigh, in the leg, because of varicose veins, varicositis, and inflammation of the veins, usually painful, tender, not really a life-threatening condition. The second type of thrombosis is deep venous thrombosis, that is to say thrombosis of the deep veins, mainly in the calf. These are may dislodge and cause pulmonary embolism, life-threatening condition, serious condition, and should be diagnosed early and treated accordingly. Arterial thrombosis, this occurs mainly in the blood vessels, arterial blood vessels, most commonly coronary arteries. When there is thrombosis, there will be myocardial infarction. In the cerebral arteries, when there is a thrombosis, it will have brain infarction, cerebrovascular accident, both mainly caused by atherosclerotic changes, turbulence of blood flow, and complication of atheroma. This picture here shows uh, thrombosed superficial veins, superficial thrombophlebitis, uh, as you see, distended and occluded superficial veins. Where in this picture, patient have a deep venous thrombosis, as you see. This leg is swollen, increased in diameter. There is redness of the skin, usually accompanied by dilatation of the superficial veins as they act as collateral for blood flow. May be painful, although some patients, about 50% of patients, they are asymptomatic for this complication, and they have a major risk for pulmonary embolism, which is a very serious and life-threatening condition. This diagram shows what is called the mural thrombosis. The mural thrombosis is cardiac thrombosis. It's more likely to be arterial-like thrombosis when the heart, as you see, when the heart has myocardial infarction. This area will be non-contractile. There's no contraction in the heart muscles in this area because of infarction and death of cells. So this non-contractile cell area will have sluggish blood flow, and this sluggish blood flow with endothelial injury will promote thrombus formation in the heart. This is called a mural thrombosis. This postpartum picture after patient death. This is the heart, this is the left side of the heart, this is the right side of the heart. You see there is a mural thrombosis in the left ventricle, and this is a major complication. Now we talk a few words about embolism. Embolism means detached solid or fluid or gaseous material within the vascular system. So what we have here, there is fragment of a thrombus or fatty droplet or materials fluid like amniotic fluid, or sometimes gaseous materials like air in severe trauma or in surgery. These enter the vascular system and travel through the vascular system until reaching mainly the lungs, mostly the lungs, and blocking the pulmonary arteries, causing hypoxia, anoxia, and pulmonary infarction, and very serious and fatal condition. What are the causes of embolism? As we said, embolism could be caused by a thrombus or caused by ulcerating atheroma plug. Sometimes patients have, for example, atheroma in the carotid. So this atheroma, when there is ulceration and dislodgement from the carotid arteries, the emboli will travel to the brain and block cerebral arteries and cause brain infarctions, leading to cerebrovascular accident and stroke. Sometimes part of the tumor present as emboli. Fat globules, fat materials mainly present in the long bones. So we have patient with a trauma, road traffic accident, or war trauma. There will be fractures of the long bones. So fat droplet will travel through the vascular system and will also affect other organs like lungs. Bubbles of air, as in trauma or surgery, amniotic fluid in certain obstetric conditions. Amniotic fluid may escape to the vascular system and cause emboli. Pulmonary embolism, it is the most common type of thrombosis of emboli. Sorry, it is the most common type of emboli. It is mostly originate from deep venous thrombosis in the cuff, usually in the cuff. So patients usually have pelvic surgery, have major abdominal surgery, or have orthopedic surgery, and long bed resting. So thrombosis will occur in his deep veins. So when he starts to be mobile, this thrombi will dislodge from deep veins and travel through the inferior vena cava, right atrium, right ventricle, onto the pulmonary arteries and causing severe symptoms. Patient may suffer from dyspnea, shortness of breath, chest pain, and hemoptysis, yeah, which is bloody sputum from his mouth, and this is a very serious condition and could be fatal. This picture shows a CT scan of the patient, computed tomography of this patient with angiogram. Angiogram is a dye injected to the patient to color the blood. As you see in this, these are the pulmonary blood vessels, and if you notice with the red arrow, there is a serpentine-like shadow, a worm-like shadow obstructing the blood flow in pulmonary bifurcations, this including the pulmonary arteries and preventing blood flow to the lungs. This is a classical diagnosis of pulmonary embolism. In this picture, we see this is autopsy postmortem picture. You see here, this is called a saddle emboli. Saddle from the word saddle when you use when riding horses. This is saddle embolus. The emboli traveled through the pulmonary artery, and at the bifurcation of the artery, they totally occlude both pulmonary arteries occlusions, causing severe hypoxia and respiratory failure and death. This is a very serious condition. This diagram summarizes types of the pathogenesis of pulmonary embolism. Usually when we have a cardiac failure, there is slow blood flow. So patient may have deep venous thrombosis from which emboli will detach and goes to the pulmonary artery, and this pulmonary artery will be occluded, leading to ischemia to the remaining tissue. This is called a wedge-like infarction, wedge or triangular type of infarction, that is the blood supply of this artery occluded by emboli. Also, we have systemic emboli. Systemic emboli means mainly in the systemic circulation, originate from the heart or aorta. So it is in the from the left side of the heart. So emboli will be transferred into brain or spleen or kidney. In the systemic circulation will be affected, and affected organs will suffer from occlusion and obstruction. The commonest cause for this emboli is atrial fibrillation. Atrial fibrillation هو irregular contractility of the atria of the heart. When there is irregular contractility of the atria of the heart, there will be stasis of blood in the atrium. Blood stasis will impair blood flow, and this will induce in turn formation of a thrombi, and these thrombi will be source in the left side of the heart, will be source of emboli, showering emboli to the brain, kidney, and maybe to the spleen. This diagram summarizes what embolism. There is fracture in the long bones. Patient, human being after 50, there is considerable amount of fat in the bones. So fat will be traveled through the vascular systems and may reach up to the pulmonary area and cause symptoms related to respiratory distress. Sometimes travel up to the brain and cause a sort of confusion. This diagram of a baby in the uterus with amniotic fluid, and when there is a trauma to the uterus or there is intervention for one reason or another, there will be some of the amniotic fluid, will enter the circulation and will be a source of emboli. Still, it is a serious and risky condition. So in summary, I want you to remember the pathogenesis of a thrombi and refer back to Virchow's triad. The the turbulence in the blood flow, the endothelial cell injury, and the hypercoagulability. As we mentioned, a little bit more details in the handout that will be uploaded to you. The fate of a thrombus is very important. Um, Either resolution or propagation or emboli formation or recanalization. This is the fate of thrombola. Emboli have different types: thromboembolic, tumor, airborne, fat, and amniotic fluid emboli. This case for you, if you have extra time, it's a sort of exercise. I like you to scan it after you complete the lecture, after you listen to the lecture and you uh, read the handout, scan this case and you see if you can manage to answer the question. Thank you very much.